Hi guys, welcome to our another lecture of the gross anatomy of the abdomen. So today we're going to talk about abdominal muscles, muscles in the anterolateral abdominal wall. Right. So from this diagram, you can actually see that these are the muscles. This right here is your external oblique muscle. It goes downward and forward. You can actually see downward and forward. Right. The external oblique muscle is superficial. Deep to it, you're going to have internal oblique. And deep to the internal oblique, you're going to have the transversalis abdominis. That's the lateral wall. In the anterior wall, you're going to have two important muscles. From here, we can actually just see this muscle, which most of the people are crazy about, right? The six pack. That's your rectus abdominis muscle, right? We're going to talk about it very soon. And then it's going to also have another muscle right here that is going to be called your pyramidalis muscle. Right, so let's take a look now. Right, so the external oblique, yes, these origins, it originates from lower 8 ribs, right? It also originates from the anterior half of the iliac crest, right? And inferiorly, the external oblique, it will have an aponeurosis, and this aponeurosis that will be extending from the anterior superior iliac spine to the pubic tubercle, that is famously known as the inguinal ligament. So the inguinal ligament is actually an aponeurosis of the external oblique muscle. Good. Posteriorly, this muscle, as you're gonna see, let me look. Right, so posteriorly, you can actually see that it is a free border, a free posterior border of the external oblique, right? And LB, posteriorly, it does not, LB does not originate from the does not originate from the thoracolumbar fascia. It is the free body, right? So it is this origin, lower 8 rib, right? The anterior half of the iliac crest, right? And then it's going to insert into the linea alba, right? And as well as the pubic tubercle. You understand? Good. So, what's the nerve supply to the external oblique? The external oblique is supplied by the following nerves. If you remember in thorax anatomy, we spoke of the the thoracic nerves that are divided into typical and atypical, and we say the thoracic nerves of T3 to T6. These are typical thoracic nerves, and then the lower 6 thoracic nerves, which are now referred as the thoraco-abdominal nerves, from T7 to T12, right? They supply structures in the abdomen. So they are going to supply these muscles, right? Together with the first lumbar nerve, which is A1. A1, right? So you're going to discover that A1 is going to give two terminations, the iliohypogastric and ilioinguinal nerve. So the iliohypogastric nerve, the ilioinguinal nerve, they are going to supply these lateral abdominal muscles. Good. Now, let's take a look at the internal oblique a little bit. So this is the internal oblique, right? Is going to have the the following origin, right? Is going to originate from the thoracolumbar fascia, and it's going to originate also from the thoracolumbar fascia, anterior two-thirds of the iliac spine, right? And then it's going to also originate from the lateral one-third of the inguinal ligament. That ligament that we said is formed by the external oblique. Yes, the lateral one-third of the inguinal ligament is attached origin for the internal oblique. And then for the insertion, the internal oblique is going to insert on the linea alba. And together with the transversus abdominis muscle, they are going to form what we call a conjoined tendon that will insert at the pectinal line. Right. You're going to look at this as we're going to do the inguinal region. Right. And then if we reflect this, we are going to have this muscle called the transversus abdominis muscle. It also originated from the thoracolumbar fascia, as you can see here, right? And it also originated from the iliac crest, right here. Good. But does not originate from the inguinal ligament, and it attaches to the linea alba. You understand? So those are the three important lateral abdominal muscles. And take note of this, all these muscles, they are going to be innervated by the following: the thoracoabdominal nerves, that is T7 to T12, and the first lumbar nerve, that is your iliohypogastric nerve and your ilioinguinal nerve. We understand? Good. So let's take a look at the muscles that are found in the anterior abdominal wall. That's your rectus abdominis muscle. Right, so you can actually now see we are now in the anterior wall, right? So, okay, there's another thing that I left. Let me correct something here. So the transversus abdominis, right, muscle, it also originated from the lateral third of the inguinal ligament, right? So it has similar origin from the internal oblique muscle. Good, right? Good. So let's get to the anterior abdominal walls muscle. So right here, this is your rectus abdominis muscle. Let me zoom a little bit. Good. This is your rectus abdominis muscle. It is bilateral, so you can find it here and here, separated by a linea alba. Right, so the rectus abdominis muscle, you can actually see that this muscle is going to be divided into pecs by tendinous intersections. So you have three tendinous intersections or more, right? The first one is at the level of the xiphoid process right here. The other one is at the umbilicus, and the third one is at the mid between the two, right? So this muscle is going to be enclosed into a sheath that we're going to talk about in the next video, which is called a rectus sheath, right? So the rectus abdominis is going to be enclosed into a rectus sheath. You understand? Good. Another muscle in the anterior wall is going to be your pyramidalis muscle. It's just a triangular muscle which originates from the pubic tubercle and insert to the linea alba. Its function, it tenses the linea alba. It tenses the linea alba, right? So this pyramidalis muscle, take note, is going to be absent in 20% of population. So in 20% of population, the pyramidalis muscle is absent, right? So let's talk about the nerve supply of the rectus abdominis muscle and the pyramidalis muscle, right? So since we said the rectus abdominis muscle is enclosed in the rectus sheath, also the pyramidalis muscle is also enclosed in this rectus sheath. So you're going to have the thoracoabdominal nerves found in this rectus sheath. A1, take note, A1 is not found in the rectus sheath. So therefore, the rectus abdominis muscle and the pyramidalis muscle, they are innervated by the thoracic nerves of T7 to T12. They are not innervated by A1. You understand? And more specifically, the pyramidalis muscle is going to be innervated by T12. T12. Only T12. Only T12. You have to understand that. So an MCQ question can come and say, in a 20% of population, there are two muscles in the anterior wall of the abdomen. Is it true or false? That is true. Remember, these are bilateral muscles. So you're going to have two rectus abdominis muscle, two pyramidalis muscle. But since we said in 20% of population, we have the pyramidalis muscle absent. So therefore, in 20% of population, you're only going to find the rectus abdominis muscle in the rectus sheath of the anterior abdominal wall. Are we together? Good. So let's take a summary. The muscle of the abdominal wall of the anterior lateral abdominal wall. We have three muscles in the lateral wall and two muscles in the anterior wall. In the lateral wall, these muscles, they are responsible for lateral deviation of the abdomen. In the anterior, they are responsible for flexion of the abdominal wall, right? In the lateral wall, those three muscles, they are going to be innervated by T7 to T12 together with A1. But in the anterior wall, you're only going to have T7 to T12 supplying your rectus abdominis and only T12 supplying your pyramidalis. Take note, the pyramidalis is also the level of the pyramidalis can also be an incision point, right? So you can actually make an incision at this level, right? Since it's a muscle that can be absent, right? So you can actually cut through it and expose certain viscera. Good. So thank you so much, guys, for listening. See you next time.